Hi, Walter Sim from the Straits Times of Singapore. Thank you so much for your analysis, and I think this actually goes a very long way in explaining why the infections happened the way they did on the ship. And I think the international community should appreciate that. But I also can't help but ask if you think that the response on Diamond Princess was perfect, or if you think that there's anything that could or should have been done better on the ship, whether for passengers, for the crew members, or for even the government officials who are working on board. Thank you.
Well, I'm an epidemiologist, and again, my interpretation is not necessarily representing the government's position. And well, first of all, as you see this figure, the first figure, the number of new cases reached the peak on February 7th, 2 days after the quarantine started, and then declined afterwards. So first, we can say that many cases had been occurring before the quarantine started, or before arriving Yokohama port. That is one interpretation. And there is a peak on February 7th. Probably many of them were infected before February 5th. You know that the average incubation period is about 5 days. So that this peak is showing the patients who infected before February 5th develop the symptom around 2 or 3 days after the quarantine period. And then the number declined afterwards. So as Dr. NISHIURA showed, the quarantine or the isolation measure itself was effective. It may not be perfect, but it was clearly effective. And yeah, and that is the point for the passengers and for the crew members, as I have explained at the beginning, especially at the first stage, immediately after the quarantine period, they have to maintain the operation. Especially, they have to prepare the foods and also serve the food for the passengers. So they have to move inside the ship. So they were not fully isolated. Well, but considering the situation, it was probably no way. They had to walk, otherwise passengers cannot eat anything. So that as a result, as you see, the number of cases among the crew members gradually increased. But after understanding the situation, the quarantine office stopped the crew members to move freely. So then, afterwards, the number of cases among crew members declined. So then this is my interpretation again. This quarantine measure or the isolation may not be perfectly ideal, but considering such an emergency situation, nobody was expected such an event had occurred. And then the ship doctors, cruise ship doctors, nurses, and medical teams, and quarantine officers, I think they did the best. And actually, it worked. Isolation worked. So the number of newly developed cases declined, both passengers and crew members. But again, maybe it was not perfect, 100% perfect. So you know that after 14-day quarantine period, from the day before yesterday, we screened all passengers, and then if they did not develop any symptoms during this period, number one, if they did not develop symptoms, number two, if PCR was tested negative, and the third, not close contact, sorry. Okay, so no symptom, PCR negative, no close contact. If the passenger fulfill this criteria, they can disembark the ship. But we still aware that there is, maybe Dr. NISHIURA can explain more numerically, that there is a small risk. There are still remaining some cases among these passengers who are disembarked. We are aware of this risk. So that the Ministry of Labor and Welfare are asking all passengers who disembark to stay at their home as much as possible. And then also asking them to measure their temperature every day. And Minister MHLW officers are calling the passengers regularly. So this measure is taken for 14 days after the disembarkation. So this is my interpretation and also additional information. And Dr. NISHIURA.
So the question is if the countermeasures on board was appropriate or not, or something like that.
Or if anything could or should have been done better.
Okay, thank you. First of all, in the retrospect, we can say many things, but during the course of the epidemic, I would reiterate what Dr. Suzuki said. Perhaps the quarantine office and captains on board implemented the best practice that they were able to do. And in relation to that, firstly, what I have to emphasize is that we are preparing the manuscript to report the analysis of the epidemic dynamics on board. And of course, the spatial map was explored, in what the rooms the transmission have occurred. And when the epidemic was recognized on 3rd of February, we have seen that the transmission was quite diffuse across the different levels of cabin. And therefore, unfortunately, it looks that the epidemic has caused multiple chains of transmission when it was recognized. Therefore, it was already in a phase that it was very difficult to control perfectly. And secondly, as I analyzed the reproduction number declined from the value of about 5 point something to the value around 1. What it indicates is that about 80% of transmission was prevented by the isolation measure. And the remaining 20% unfortunately remained, but the restriction of movement was very effective in that regard. So quantitatively 80% effective is what we have found. And thirdly, even with that policy, what we can tell is that even in a single room cabin, there were a few transmissions observed, and the pathway of transmission was not fully cut by the control policy that was implemented. Therefore, there was some positive side and also the negative side on the whole. Yeah. Thank you.
Any other questions?
My name is Shimata. I'm correspondent of NHK, usually covering diplomacy. So my question is not special from the specific point of view, but I'm always thinking about why Mr. Iwata, professor of Kobe University, why he has to do make his caution through YouTube. And in Japan, some professors, specialists like you, joining government operation, and why he couldn't join such kind of operation, and why he has to criticize the measure within the cruise ship and inside the cruise ship, and so how is now the cooperation between specialists or professors in Japan? Maybe there is an infection of position of academics, maybe sometimes some professor who usually criticize the government cannot join such kind of operation. Maybe such kind of situation is the origin of this problem. So how do you think about why Mr. Iwata had to do like that?
I must tell that we are not here to comment anything about Professor Iwata, who is actually a very good friend of mine. And I'm very sad that he has reacted in that way this time. He had a very bad trouble. And therefore, I have to tell that we are not in a position to comment on that issue for now. But as you already know, that he was supposed to join the DMAT to do his job on the board, but he was not in a, he didn't have an opportunity to join in that team for some reasons. And unfortunately, that developed into trouble. So that's already what it is widely discussed, and nothing more that we can comment.
So there is maybe not enough chance for all specialists to join this operation, or how can I say? Maybe Mr. Iwata, he wanted to join the team, but he had to choose in different way to see inside of the ship. So now how the medical specialists or professors helping or joining this operation, who choose the member of professor who can join this operation? Because it also maybe depends on their attitude to government, or maybe position in the academic.
Ministry.
As a public official in Ministry of Health, actually the most of the I'm a medical officer of Japanese Ministry of Health, and Dr. Iwata is really respected among our colleagues. And he, as you know, he was one of the advisors at the time of H1N1 influenza pandemics. And Dr. NISHIURA and Dr. Suzuki. Dr. Suzuki is staff professor of NIID, so National Institute of Infectious Disease, and Dr. NISHIURA is also the professor of Hokkaido University. And basically, our Minister Kato is really welcome to outside knowledge, outside experts to be in a team, and he's really welcome the professors to his own rooms to have their analysis, even it contradicts with his original policy, but with the data and analysis, he welcomes the outside professors. And I think I'm not sure the fact itself. Dr. Takayama and Dr. Iwata and Dr. NISHIURA, and they are working very hard to improve the infection control in Japan. So maybe the style to pursue in the way is a bit different from person to person, from the expert to expert. So, but basically, we usually have the good communication among the professionals with our colleagues in Ministry of Health and the professors in the university in Japan. Also, the boarding professors and boarding colleagues in CDCs and boarding colleagues within WHO. So yeah, that kind of trouble is not the ideal one. Yeah, we need to cooperate together.
Are there any other questions?
From the Associated Press. I would like to ask a question related to Australian and US passengers who had confirmed to have infected after they returned home. And I think there were 2 cases reported from Australia among the passengers who had initially tested negative for the virus. And I think there are about a dozen cases in London among Americans. And I was just wondering if there's any explanation how that happened, and if a similar thing could happen among those passengers who got off after testing negative for the virus test and went home.